Quebec is considered as having some of the best access to abortion in the country, but some experts and doctors say there continues to be a lot of challenges that need to be addressed, specifically in Quebec City, where there are delays in getting surgical or procedural abortions in particular. Those typically happen past the 10 or 12-week mark in pregnancy. It's what happened to a woman from Gaspé who had to travel 900 kilometers a few years ago to get access to a procedure in Montreal. Rose Gervais was 12 weeks pregnant with her third child in 2023 when she was told the fetus didn't have a brain and the pregnancy was no longer viable.
C'était clair que je ne pouvais pas faire interrompre la grossesse à Gaspé parce que j'avais dépassé les délais là, de 12 semaines et 6 jours. Donc, il fallait que je me redirige vers Québec ou Montréal.
Gervais and her partner planned on getting the procedure done in Quebec City, where they could also be seen by a geneticist. But she says the delays were too long, and they opted to travel to Montreal instead.
J'avais tous les symptômes là, d'une grossesse normale qui continuaient. Puis là, c'est ça, les délais à Québec, ça me donnait encore une autre semaine de grossesse, si on peut dire.
Experts and doctors say her experience speaks to a larger issue and an urgent problem. A community organization that helps women access medical abortions in Quebec City says barriers faced by women like Gervais are disheartening, and the provincial capital needs more service points for surgical abortions, considering it covers neighboring territories.
Certaines personnes vont vouloir avoir accès à une interruption de grossesse par médicament, mais les délais font en sorte qu'elles ne pourront pas y avoir accès. On trouve ça vraiment désolant que l'accès soit pas plus simple.
Some advocates are also concerned about the government possibly increasing funding and resources for medical abortions only. Those use the abortion pill, but they must be done early on in pregnancy. They're also much less expensive on the healthcare system. Advocates worry the government may prioritize medical abortions instead of also funding the resources needed for surgical abortions. They say women should have as many options as possible.
So that's the sort of the red flag that we've been waving. It's supposed to be complementary. It's supposed to be a second, more expansive option. It's not supposed to be replacing in procedural abortion.
Dr. Mathieu Bélanger is also highlighting the gaps in service in Quebec City. He works at the Saint-François d'Assise Hospital, the only place offering surgical abortions in Quebec City for patients entering their second trimester.
I see the woman in clinic. I see the woman at SOS Grossesse who tried to have an appointment at the hospital, and I see how much they suffer. I see how they tried, and we have to understand that for them, it's a crisis.
He says the hospital didn't know the wait times for surgical abortions here or how many phone calls go unanswered at reception. Bélanger wanted to know why, but says he wasn't given a clear answer by his hospital.
It's extremely disappointing for any kind of healthcare provider to not be able to give care to someone because, the structure behind does not support you well enough.
In an emailed statement, the Chute de Québec Université Laval Hospital Network, which oversees the Saint-François d'Assise Hospital, says it offers about 50 pre-consultation slots per week and between 28 to 32 intervention slots, depending on availability. As of April 1st, 2026, the wait to have a pre-consultation appointment is about 3 business days, and an additional 2 to 3 business days for an abortion. Quebec's health ministry called access to an abortion a priority and said it's committed to ensuring women seeking an abortion will have access as quickly as possible. But it said efforts must continue. It referenced its action plan on abortion access that supports the operation of health centers and the development of new service points.